Back now to our top story, the one about private medical aid schemes being accused of defrauding patients. And South Africa's largest health administration and medical risk management solutions provider and owners of Medscheme, that's AfroCentric, has welcomed the release of the Competition Commission's final health market inquiry report. To tell us more about what they think about all of this is Executive Director for Health Management, Dr. Lungi Nyathi, joining us this evening. Doc, good evening, and thanks for your time. Thanks for coming in. So you have welcomed this. So I suppose, most consumers have long felt like we've been held hostage by our medical aids, that we've been taken advantage of because we want the best health care. Would it be wrong to feel that way?
No, it's the right thing. Everyone wants the best for what they pay for. It's like when you have insurance for your car. When you need it, you want it to be able to pay. And so it's the same for healthcare. And healthcare is it's a basic right. And it's such an emotive thing. You're mostly vulnerable when you need it. So it's correct for us to expect the best when we need it.
So you've welcomed this inquiry, or the findings, the recommendations. What parts of this stand out most for you as being involved in the industry itself as well?
Quite a few things. I think it's been long awaited. There are some regulatory gaps. As an industry, we've been working almost with a limp because we implemented some regulatory changes, but not all of them. And so that's impeded our ability to make some key changes. And there are things like that help us to manage the cost of PMBs that can be helped by regulatory changes. There are some regulatory changes that relate to how we pay doctors at the moment. For every little thing that a doctor does, we pay for. And when you get your hospital bill, you pay for a swab, you pay for a needle, you pay for everything. And what we're hoping for is to start bundling some of those claims and being able to pay for them. We also don't like it that doctors work in single practices. We'd like them to work more as teams. That would help the cost of care. And so some of those regulatory changes and some of the innovations that we can put in place if we change some of the regulation is what we're looking forward to the most.
So having been involved in the industry and, sort of keeping your eye on, I'm sure you're keeping your eye on various medical schemes as well. I mean, why was something not done sooner if the knowledge was out there that this is what's being done to consumers, patients?
The million-dollar question. Why hasn't it been done? And it's one of the findings, actually, of the health market inquiry. It's one of the things that the Chief Justice says is there were provisions and clauses in the National Health Act that could have enabled some of the implementation of some of the recommendations. And part of their recommendations has to do with taking regulators to account for things that they should have implemented that they didn't. And so some of it is just I suppose not enforcing what could have been enforced.
Okay, so we saw them getting away with it and we did very little about it, is basically what's going on. So NHI, I mean, we're continuing to have that discussion. How will which one will impact which in this case? I mean, findings like this, the changes that need to be made, and the discussions around NHI? They
dovetail with each other, but it is all about sequencing. There are quite a few things that would in any case have to be put in place before NHI comes into full effect. There are changes in some regulation that needed to happen anyhow to get NHI. And some of the recommendations of the health market inquiry, for example, the supply side regulator, and some of the recommendations about changes to how providers are regulated, those are critical anyway, even if we're in the NHI space. So there are some things that need to be implemented from the HMI first before NHI, and some of the recommendations are similar. But the key thing is that the regulators must be skilled enough and understand enough and capacitated enough to watch it closely and follow a nice sequential pattern.
So I suppose the question that everyone's asking at home is, how soon can we expect these changes? How soon can we expect, those monthly contributions to drop?
To come down.
Yeah.
I mean, I think there's some low-hanging fruits, and 2020 is past now because most schemes have already announced their contribution increases for 2020.
The timing couldn't be worse, could it?
Unfortunately. But we've got a good 9 months or so to work through some of these changes, hopefully to impact 2021. And so there's some very low-hanging fruit that could be put in place, changes to some of the regulations for Health Providers Council. Some of those can be put in place quicker.
Okay.